Angina is a general term that's used for patients who are having pain coming from blockages in their arteries. In specific, angina pectoris means pain in the arteries of the heart. So if you have a blockage that is affecting blood flow to the heart, it can cause chest pains, chest pressure, shortness of breath, mostly on exertion. It can also be chest heaviness. It can be other symptoms that can be need to be evaluated by a cardiologist or your physician. Angina can be divided into stable and unstable conditions. So stable angina is a defined pattern of chest pain that happens with exertion and is reproducible with similar level of exertion. Other category would be unstable angina. Unstable angina is where we see a change in symptoms. When there's a change in symptoms, it could be either increased severity of chest pain or chest pressure, for example, or it could be increased frequency, or it could be duration, that is lasting longer and is not going away with the same amount of rest, let's say, that it did in the past. So when we have unstable angina, it can transform into a heart attack. Essentially, heart attack happens when you have a blockage in an artery that is unstable and it is close to 100% blocked or nearly 100% blocked. In situations like this, there is damage to heart muscle. There is condition called myocardial infarction or heart attack. So a change in symptoms from stable to unstable can be a heart attack. Also, if you never had chest pains or chest pressure or shortness of breath and you have new onset of symptoms, this can also be classified as unstable angina or potentially myocardial infarction. If you have symptoms that are concerning for new chest pain or a change in the frequency or severity or duration of existing chest pain, you could be having a heart attack. In those situations, you are advised to seek medical care, be evaluated and by a physician, preferably a cardiologist.